Hello again. This this segment here, we're going to start module 13. Now, that's a really pretty large module. There's a lot of stuff to cover in this module. So this is going to be part one. I'm going to break it down into two parts, and just so you don't have to look at my smiling face too long at one time. Also, because 12 is pretty short, 13 is pretty long, I'm going to, as you know, the modules are open for a week. I'm going to leave 12 alone, but I'm going to open 13 up a week early during the same as a week 12. So that gives you extra time. If you get 12 done, you can start into 13 if you want to. If you want to wait till Sunday, that's fine with you. So anyhow, we're going to get started here on 13, module 13, part one. And it's called work-related musculoskeletal disorders, which you probably already knew that. So objectives here are to establish a basic understanding of various musculoskeletal disorders caused by occupational exposure to physical workplace risk factors. I've kind of looked at myself in the background a little bit, and that thing looks kind of weird, doesn't it? Anyhow, musculoskeletal disorders are a broad class of disorders involving stuff that is in my way. Damage to muscles, tendons, ligaments, peripheral nerves, joints, cartilage, vertebral disc, bones, and or supporting blood vessels. Musculoskeletal disorders are not typically caused by acute events, such as an accident or trip and fall or something like that, but occur slowly over time, which we call what? As opposed to acute, it's chronic, due to repeated wear and tear or micro trauma. The term we use for that repeated wear and tear that's going to get to you sooner or later is called micro trauma. MSDs are also known as, and you've seen this before, cumulative trauma disorders, CTDs, repetitive strain injuries, RSIs, repetitive motion trauma, RMT, occupational overuse syndrome, which that poor thing doesn't have a little acronym behind it, so too bad. Examples of work-related musculoskeletal diseases are herniated disc, epicondylitis, which is also called tennis elbow. Even if you don't play tennis, you can still get it. Tendinitis. Notice tendinitis is also spelled Tendonitis. Either way is acceptable. Deca-Vein syndrome, tenosynovitis of the thumb, trigger finger, and Raynaud syndrome, also called white finger. This unit is not designed to impart skills in the diagnosis of work-related musculoskeletal disorders. Only a healthcare provider can do that. It provides background information in some of the most common WMSDs and explores the anatomic features that are affected by them. This chapter is divided into 4 sections: the musculoskeletal system, disorders of the spine, upper extremities, lower extremities. Musculoskeletal system provides form, support, and movement to the body. And without your musculoskeletal system, where would you be? Laying on the floor. 206 bones compose the skeleton, about half of which are in the hands and feet. So that's a lot of bones in the hands and feet. Why? Pretty obvious, right? Pretty obvious why. Humans have over 650 muscles, which constitute about 40% of the body weight. Of course, that varies from person to person. The special function of muscle tissue is contraction, making the muscle shorter and thicker. That's what muscles basically do. There are 3 kinds of muscle tissue: striated, smooth, and cardiac. Most of the muscles are striated, which is the skeletal muscle. It's also called a voluntary muscle because it can be consciously controlled via the central nervous system. Muscles can only pull in the direction of the contraction, so they are frequently arranged in antagonistic or opposing pairs. For example, the biceps contracts your arm and it's pulled, and your forearm is pulled towards your upper arm, which is called flexion. And then your triceps contracts and your forearm is pulled away from your upper arm, which is called extension. So you have flexion and extension by the antagonistic pair of muscles in your arm. If you didn't have them, you'd be able to move your arm one way, but wouldn't be able to get it back. Tendons and ligaments bear the burden of forces during muscular contraction, so are common injury sites for work-related musculoskeletal disorders when the physical workplace risk factors go uncontrolled. Tendons are an integral part of the musculoskeletal system. These sturdy bands of fibrous tissue attach muscles to bones. They pretty much hold it all together. They're like cables. Their length and thickness, depending on the function. Wide, thick tendons support the hip, while long, thin tendons move the fingers. Anytime you move your fingers, you're moving tendons. Tendon disorders tend to occur at or near the joint, where, surrounded by synovial sheaths, the tendon rubs on adjacent ligaments or bones. Repetitive movements or awkward postures can cause friction between the tendon and the bone, resulting in heat or inflammation at that site as well as wear. Tendons and ligaments are somewhat elastic and will stretch in response to tensile loading. With increased tension, tendons become stiffer. If the load exceeds the elastic limit of the tendon, that's its ability to recoil to its original configuration, permanent changes occur. You don't want that to happen. Tendons are also subject to perpendicular oriented compression loading as they turn corners around bony surfaces. This friction is significant in the hands and wrists. Higher levels of muscle tension are required to achieve a specific level of strength at the fingertip during non-neutral wrist postures. A great many tendons run across the wrist on the front and back side. This is the back side showing here. Back of your wrist. If you hold your hand like this, as I'm looking at my hand, you'll be looking at yours. These tendons repeatedly slide back and forth with each movement of the wrist and hand. So as you can see, there's a whole bunch of them. And when you actually move your muscle, move your fingers, you're not really using a muscle in your finger, you're using the muscle in your arm, and it's pulling the tendon. Ligaments are fibrous bands or sheets of connective tissue linking two or more bones, cartilage, or structures together. Ligaments connect and hold all bones together. Hyperextension or hyperflexion may be restricted or prevented by ligaments. The biomechanical properties of ligaments parallel those of tendons. We'll talk about ligaments when we get down to the lower extremities more. But they're similar to tendons, the biomechanical properties of them. Articulating surface of bones are covered with a shiny, smooth, white connective tissue called cartilage. It absorbs shock and provides an extremely smooth surface to make motion easier. It can be up to 1/4 inch thick in the large weight-bearing joints such as the hips, and thinner in joints such as elbows. Cartilage is subject to two types of stress: gravitational pressure, particularly from weight-bearing joints of the legs and feet, and the friction from the movement itself. Cartilage can become damaged by either blunt force trauma or excessive wear. Since it does not contain blood vessels, it's reluctant to heal. So cartilage doesn't heal because it doesn't contain blood vessels. Nerves. The nerves that control our voluntary and involuntary movements exit the spinal column in different regions. Injury from any form to a specific vertebrae area of the spine can affect other areas of the body. For example, a neck problem could cause pain or reduced strength in the arms and hands. Ergonomics is generally concerned with only the voluntary skeletal muscles, not the smooth muscles or the cardiac muscles. Muscles are composed of thousands of tiny fibers all running in the same direction. They are red because they're filled with many blood vessels that supply them with oxygen and nutrients and carry away carbon dioxide and waste materials. Muscles can be injured pretty much in three ways: strained or irritated, causing temporary aching or swelling. A small group of fibers can be torn apart, or a muscle may be subject to a severe blow and crushed, breaking many of its blood vessels and causing blood to seep in a broader area. We call that a bruise or a black and blue mark. The skeleton, 206 bones, is a recap of what we talked about, half of which are in the hands and feet. That's the skeleton. Muscles, there's about 650 muscles, comprising about 40% of body weight. There are three kinds of muscles: striated, smooth, and cardiac. If you haven't guessed by now, cardiac or heart muscles. Most muscles are striated, which are skeletal muscles. They are called voluntary muscles because they can be consciously controlled through the central nervous system. These are the ones we are concerned with in our study of ergonomics. Tendons are sturdy bands of fibrous tissues that attach muscles to bones. They hold it all together. They are like cables. Their length and thickness depending on the function. Wide, thick tendons support the hips, while long, thin tendons move the fingers. Ligaments are fibrous bands or sheets of connective tissue linking two or more bones, cartilages, or structures together. Ligaments connect and hold all the bones together. Tendons and ligaments are somewhat elastic and will stretch in response to tensile loading. Somewhat, not a whole lot. Articulating surface of the bones are covered with a shiny, smooth, white connective tissue called cartilage. It absorbs shock and provides an extremely smooth surface to make motion easier. It can be up to 1/4 inch thick in the large weight-bearing joints such as hips, thinner in joints such as the elbow. Well, you can imagine what it would be like without cartilage if bones were just rubbing against bone. Wouldn't work very well. Cartilage is subject to two types of stress: gravitational pressure, particularly from weight-bearing bones, the legs and feet, and friction from the movement itself. Cartilage can become damaged by either blunt force trauma or excessive wear. Since it does not contain blood vessels, it's reluctant to heal. The nerves that control our voluntary and involuntary movements exit the spinal column in different regions. Injury of any form to a specific vertebrae area of the spine can affect other areas of the body. The spine is one of the most important, sophisticated, and complex structures in the body. It is affected by almost every movement made. The vertebral column, or the spine, consists of 33 irregular shaped bones, the vertebrae. It extends from the base of the neck to the pelvis. Its major functions are to distribute the weight of the trunk evenly to the lower limbs while protecting the spinal cord and providing attachment points for the ribs and muscles of the neck and back, as well as providing a pathway for nerves from the central nervous system of the brain to the distal regions of the body. Now, that's a lot what it does, okay? Its major function distributes the weight of the trunk of the body evenly to the lower limbs, the legs, pelvis, all that, while it's protecting, oops, hit the wrong button, while protecting the spinal cord. Remember, the vertebral column is not, the spinal cord's inside that, so it's got to protect that. And it gives you attachment points for ribs and the muscles of the neck and back, and a pathway for nerves from the central nervous system. So that spine is pretty doggone important. The cervical spine, beginning at the base of the skull, has 7 vertebrae with 8 pairs of cervical nerves responsible for controlling the neck, arms, and upper body. That's the cervical. That's right up at the top of your neck. This group is sturdy, enabling it to support the weight of the head. The amount of stress placed on these vertebrae varies with movement and posture. This area of the spine is very movable. Directly below the cervical region, the thoracic portion of the spine starts. There are 12 vertebrae and 12 pairs of ribs, as well as nerve roots that control the midsection of the body. The ribs form the chest wall and protect many internal organs. This section of the spine is fairly immovable. Try to move this area without moving your neck or lower back. That's, I like that one here. What? It's right behind me, isn't it? Anyhow. That's your 7 cervical vertebrae, your 12 thoracic vertebrae, and your 5 lumbar vertebrae. Now, below them are the sacrum and coccyx. We'll talk about them in a second here. The third part of the spine is the lumbar vertebrae. There are normally 5 lumbar bones. However, some people have one less or one more. These vertebrae are the largest and strongest of the 3 regions, the cervical, thoracic, and lumbar, because they carry the bulk of the body's weight. 5 pairs of lumbar nerves manipulate the movement and sensory function of the lower extremities. The lumbar region is the segment of the spine under the most pressure because it is on the bottom of the spine. When a person bends over, the lumbar region is asked to bend, but still maintain the strength to hold up the spine. So we are asking a lot of our lumbar region, and that's why lumbar strains are pretty common. A mass of 5 smaller bones, which are naturally fused together, is after the last lumbar vertebrae. This bone mass is named the sacrum, and below it is a coccyx or tailbone made up of 4 little bones fused together. The sacrum and coccyx do not look like the other vertebrae at all. The pair of nerve roots originate from this area responsible for the action of the pelvic organ and buttocks muscles. The sacrum and tailbone could be considered kind of like the basement and sub-basement of the building, if I'll use that analogy. The spine has some natural curves starting from the bottom. Has the sacrum or slightly convex curve, the lumbar, the concave, which is called lordosis, the thoracic, which is convex, looking from the back, which is called kyphosis, and then the cervical, which is concave, which is also called lordosis. So you have the 2 lordoses and 1 kyphosis in there. Exact forms of these curves varies between individuals. Some have a lot more than others. The terms lordosis and kyphosis also can refer to the natural curvature or exaggeration of this curvature as well. Spinal regions reducing the biomechanic loading on the spine is a key element in prevention of spinal injury. This can be done by practicing proper postural alignment or a neutral spine when sitting, standing, and moving, including aerobic and flexibility exercises in your daily routine, getting enough rest. Do not put more force on the spine than it can handle, and this varies by person. This is the big one here. Do not put more force on the spine than it can handle. How do you know how much it can handle? That's the problem. You might find out the hard way, but generally speaking, don't lift more than you can handle. There's this a lift on the left-hand side. It's like a slice through your spinal column, and the back of the posterior is sticking up, and that's what what spinous process is. That's where you can feel your backbone in the back, and then the other one is a left posterior lateral view of articulated vertebrae, and you can see how they fit. They have the ribs, so that's looking at you from the front because the ribs facets are there, and so you can see that they are odd shaped bones. And this is a really good picture here. So the top shows what a normal disc is. That disc is that cartilage in between each one of these vertebrae. Boy, that takes a beating because it's moving. It's in use all the time, except when you're sleeping, pretty much. The degenerated disc, you can see what's happened there. It's starting to basically come apart. Bulging disc, it's larger than it should be. Herniated disc, it's really blown out there. Thinning disc just gets skinnier, and disc degeneration with osteophyte formation. So any one of those, except for the top one, can be a problem and a painful one at that. Core is a group of muscles that surrounds the trunk. Its main function is to stabilize and protect the spine and pelvis when the body is in motion. Adequate core stability not only reduces strain on the spine, but also helps maintain optimal posture alignment that will help reduce risk of injury. And there's the muscles of your core. And you can see that. If you want to look at all those muscles, you can. There they are. There's a close-up of the core, and there's even some muscles inside the other muscles. Why do so many people experience back pain? Well, our core muscles are involved in every move we make. The core muscles, they go all around, so they're all around your front back too. So anyhow, why do we have so much back pain? Well, there's kind of 4 reasons. New use, starting up a new activity. Muscles may not be used to the range of motion, force, or speed required. So you haven't done that before, and you do it for the first time, and that could be a problem. Misuse, cumulative effect of bad body use, in other words, poor posture alignment over a long period, or pushing the body too far too often. So new use is bad, misuse is bad, overuse, repetitive use of one muscle group causing an imbalance. Disuse, lack of exercise may not cause back problems, but they can result when we attempt an activity requiring a certain degree of strength or flexibility. So if you don't know, you haven't done anything at all to help your back get stronger or get used to stuff, it could only be a problem for you. Neck disorders are commonly associated with prolonged exposure to static and awkward postures, typically as a consequence of visual requirements of a task. And that could include like looking down into a microscope like this, or just looking up stuff while you're doing things, or there are some really weird neck consequences, but usually your neck problems stem from what it says there, static and awkward posture. So it's both awkward and static. In other words, it's awkward and you're keeping it there a long time. Low back disorders are typically caused by repeated loading or high forces. I think that's pretty common. We all know that pretty much. Repeated loading or high forces aren't good for your lower back. So I don't know what that says. You don't matter, give up, or you matter, don't give up. I'm not sure. Figure it out. If you figure it out, let me know. Back pain solutions. Prevention is the best health insurance. That's, of course, in anything, that's always good way to handle it, prevention. The first step to a healthy mind and body is the understanding about lifestyle choices that contribute to overall wellness. Unfortunately, in our society today, that's probably not at the top of most people's list, lifestyle choices that contribute to overall wellness. Correct posture, balanced diet, regular exercises, and stress reduction are all important factors. Stretching and strengthening can help maintain or regain range of motion. At first sign of pain or discomfort that is not alleviated by rest, that wakes you up at night or limits your after work or work activities, contact a healthcare professional. Various treatment methods are available, but if the cause of the disorder is not altered, the treatment may not be effective in the long term. And this kind of goes along with what I've been saying all along. With you or anybody that I'm assuming you're at work, you're in your company, and or where you work, and that they come to you with anything about any kind of pain, something like that, get it in the early stages, and throughout your training, try to stress that too. The earlier you can report something that's bothering you, the quicker we can do something about it, number one, and probably the better off you're going to be, because we can get working on it quicker too. So that's it for this particular part one of this module 13. And so we're going to take a break from this to give you a chance to get away from me for a while. And we'll start with part two whenever you get around to it, I guess.